Well, we've been kind of in the micro view, and now I'm going to go to the macro view a little bit and give a broad perspective. And credit to several sources for some of the data here: AccuFocus, MarketScope, Dow Jones, One Focus Ventures, Versant Ventures, Foresight, and Schroeder Ventures. So I've stolen a lot of data, but I think you'll maybe find it useful, and I work with a bunch of people. So in spite of all the rhetoric, healthcare spending keeps growing. And really, in spite of all the rhetoric, it seems to be relatively insulated from the macroeconomic trends. We have an aging population and a rising disease burden. In spite of the fact that some people think that innovation is going to raise costs, it's really innovation that has the best chance of reducing costs. If I was still doing cataract surgery the way that I did when I started 35 years ago, which was an intracapsular cataract operation that took an hour in a hospital, and the cost per patient was in the $5,000 range, versus ability to do, 3, 4 an hour at $1,500 an eye. Just think if we were trying to do 3.3 million cataract operations today the way we were doing it in the past, and then all the post-op visits and fit them with aphakic spectacles or contact lenses, it would be a nightmare. And the only reason that we can take care of our patients is because of the impact of innovation. So innovation usually, in the end, actually reduces costs, and I think is a good thing. Now, if you are an innovator and you're developing new technology, you like to have an exit. The IPO market has been relatively closed, but the good news is there are a lot of cash-rich large caps out there, what we call our strategics, and they are acquiring a new technology when it is proven. And the amounts that they're paying for that is growing. So I think that's also very positive for innovation. And many of these companies are finding that they can outsource innovation more inexpensively than they can do it themselves. That just is the nature of the beast, if you will. But the research spending has been growing exponentially. If you look here, whereas the number of approvals has been declining, and that's partly because of our regulatory apparatus in the U.S., but data does suggest that having a small, dynamic, innovative company develop new technology is about 3 times as efficient as is done by our large strategics. So to me, all of this together really is a pretty positive story for innovation in ophthalmology. We're growing towards perhaps $3 trillion per annum in the U.S. by the year 2020. Ophthalmology is about 3% of that. That's $100 billion. We have an aging population. We have technology advances. We have baby boomers who are willing to pay incrementally for quality of life outcomes. And we also have significant unmet needs, as I'll talk about in a minute. So again, I think it's a pretty positive and exciting story. We also are seeing a transition, especially in ophthalmology, to cash pay. It's not all third-party pay anymore. In our practice, actually 50% of our revenue comes from patients directly paying for what we do for them. And that is better, I think, in ophthalmology than most fields. Perhaps plastic surgery is better, but we're in a pretty good spot in that regard. This is driving a focus on customer service. There is certainly increasing competition amongst ourselves out there. Also, because of the increasing volume of care we need to provide with the aging population, we're seeing increasing integration between ophthalmology, optometry, opticianry, and in a few cases even dermatology, plastic surgery, dentistry, etc. I call that the ophthalmologist-led integrated eye care delivery model. And at this meeting, actually, ASCRS announced that we are now going to be integrating optometry. Optometrists that work in ophthalmology offices will now be welcome and encouraged to attend this meeting and get educated, if you will, side by side with their ophthalmology colleagues. The provider network, which is really the distribution channel of new technology, is strong. In the U.S., there are 19,000 ophthalmologists, 38,000 optometrists. We are all actually doing quite well. We are all afraid of the future, and we're nervous. But actually, if we take a look at the facts, we're all doing very well. And sort of success often climbs a wall of worry. But the bottom line is we're doing well, which means we can afford to acquire new technology as it evolves, particularly if there's a patient pay portion of it. And as I mentioned, there's a lot of overlap between what an ophthalmologist and optometrist does. And so as we get busier and busier with more and more surgery and treatment to occur in the ophthalmologist's hands, a good way to take care of these patients is basically to add optometry to the practice. And now over 50% of ophthalmology practices actually employ an optometrist. And I'm very pro-optometry. I've been doing this for decades, when I see the conflict that sometimes occurs between ophthalmology and optometry, it bothers me, and my simple solution is to have every ophthalmologist hire 2 optometrists, and then they all work together. Probably that won't happen, but it's an interesting thought. Now, the aging population is certainly critical to ophthalmology innovation, and over 65 is a significant number of patients seeking eye care. And it turns out that the patient over 65 consumes about 10 times the eye care of the patient under 65. And as we know now with 78 million baby boomers turning 65, there is a significant growth in that patient population. So one thought is that there is an aging population that is going to demand additional eye care. And what are the major eye-related diseases? So if you want to get in front of the parade, what might be areas that you might want to be involved in? And key ones to me are cataract, glaucoma, ocular surface disease, dry eye, blepharitis, allergy, retinal disease, age-related macular degeneration, diabetes, vein occlusion, retinal detachment, vitrectomy, and then refractive corneal surgery and refractive cataract surgery, particularly as it addresses presbyopia, which again is an aging area. And it's interesting that if you take a look at the patient, the 12-year probability of having one or more of these is quite high, but it turns out patients don't just get one, they often get them all. So they have a cataract, and they have glaucoma, and they have diabetic retinopathy, they develop age-related macular degeneration, and so the idea of capturing these patients and then having a long-term care opportunity for all these diseases is becoming more popular for a lot of us. And we used to think in our practice we want the patient to come in and have surgery, and then we don't want to see them anymore. Basically, if you will, we had a catch and release plan. Now we have a catch and capture. We want to capture that patient and retain them in our practice. And I think the same thing for the ophthalmology strategic company. They'd like to capture the patient and then provide for all the products they need for all of these age-related diseases so that they can encourage them to do all of them, if you will, with their products. Now, it's interesting, the market continues to grow. Jack showed you some data, but I think one thing that's interesting to me when you look at the dollars is that this sector over here, which is in quotes premium advanced technology, which requires what I call patient shared responsibility for the costs. When I go to Washington, D.C. and I talk about patient shared responsibility, all my congressmen and senators nod their head. When I talk about balanced billing, they all go like that with a frown. So I've learned to say patient shared responsibility. But things that require patient-shared responsibility are outgrowing, if you will, the rest of the market. And so this area where patients are allowed to participate in the costs, I think, is one that's also critical to participate in. So let's talk a little bit about a few of the little fields real quickly. Cataract surgery, definitely an aging disease. And you saw about the U.S., but it's a global world today, and unbelievably, we're on our way to 20 million cataracts a year being done in the world. And huge markets like China, the penetration there is extremely low. We do 10 per thousand in the USA, and less than 1 per thousand is done in China. Think of as that company advances, or that country advances, and their capabilities occur, the size of the market growth that can occur there. The same thing in India. There's about 4 per thousand, where we're at 10 per thousand. And the ability of patients to pay is definitely growing because there's more money. And we have a lot of unmet needs in cataract surgery. This is a huge market, 20 million a year in the U.S. and growing. And we lack safety, we lack precision. It's a good operation, but it's not a great operation. We compare it to things like LASIK. It doesn't compete in refractive outcomes. It doesn't compete in safety. And we need to get better is the bottom line. And there are a lot of things that can be improved. Incisions, capsulotomy, lens fragmentation, our ability to enhance refractive outcomes. We're moving in, if you will, to a computer-driven image-guided surgery. The laser-assisted cataract projects are, I think, starting to gain traction already. I was involved in the integration of lasers into refractive corneal surgery a decade ago, and things are happening faster with laser-assisted refractive cataract surgery than they did with laser-assisted refractive corneal surgery. I also was trained like some of the older surgeons in intercap and went through the whole extracap phaco transition, and that took decades. But things that used to take decades to transition now transition more rapidly, and I think we're going to see things change quite quickly. So the forecast is strong in this field, and I think it's probably going to be realized. and it will be patients in the baby boomer group willing to pay for it that will drive it. We have a lot of good intraocular lenses, but we still need a lot better intraocular lenses, particularly to treat presbyopia. And tremendous investment. I think most of it is now going to be driven towards accommodating IOLs. You heard about that, so I won't belabor it, but I'm quite optimistic that we will develop better accommodating IOLs, and we will see a huge increase, again, in a patient-shared responsibility sector in this area as well. It'll be definitely worthwhile investing in, and we'll see adjustable IOLs and add-on IOLs and electroactive IOLs and probably new materials as well. A lot of exciting opportunities for these advanced optic IOLs as well as the presbyopia correcting. And to get good refractive outcomes, we're going to have better ways to measure, and we need to measure intraoperatively. So we're going to start to move towards intraoperative aberrometry, maybe even eventually a surgical workstation with lasers and aberrometers, et cetera, all there available to us as we do our surgery. Glaucoma, we mentioned, again, an aging disease, and we have lousy surgery for glaucoma. We have pretty good meds, but we have lousy surgery. And next generation devices, like the MIGS devices we heard about, I think are going to be very, very popular. And I don't think they're just going to be a third-party pay type procedure. I think they're actually going to be a patient-shared responsibility elective surgery. There will be patients, once we get confident with the technology, who will be willing to pay for it out of pocket to help treat their disease and enhance their lifestyle and reduce their dependence on drugs. Presbyopia is certainly a major area of growth. Look at the size of the industry that was created in laser corneal refractive surgery in myopia, which is 25% of the U.S. population. Presbyopia is 40% of the U.S. population. So if we can get things that are safe and effective for treating presbyopia, we'll see explosions in this area. Again, projected by MarketScope to have tremendous growth. And I think one thing that's not there yet in the U.S., intracorneal lenses, are going to be one of the major technologies that's going to play a role here. These technologies being launched, such as the AccuFocus camera outside the U.S., are generating a lot of patient acceptance and also surgeon acceptance, and this, again, will be a whole new opportunity. We need ways to treat dry age-related macular degeneration as well as wet, a tremendous opportunity, and ways to treat some of the more rare retinal diseases, including the ability to take patients that are relatively blind, put in chips and give them functional vision. Retinal implants, for example, I think have a great future. So there's a lot of breakthrough technologies coming that offer, I think, tremendous opportunity. If the innovators and venture capitalists evolve these technologies and get them through the regulatory barriers, we have very healthy strategic companies that will acquire them. I've heard it said more than once from a CEO of a major company is that they're dying for new technology. They know how to sell it. They know how to distribute it. If we develop it, they'll pretty much buy anything that we develop as long as that it serves a real unmet need and is economically viable. Glaucoma, next generation retina therapy, cataract surgery, refractive surgery, particularly for presbyopia, ocular surface disease, et cetera, are to me very key issues, and there are others. So to me, a really positive story, not just in the U.S., but globally. But of course, you know, it's never all good news. There are major threats. There is a reduced ability of governments worldwide to pay. But for me, in our practice, that's really an opportunity because it means that there will be increasing patient-shared responsibility. And I even expect in the U.S. to see us go from a defined benefit plan to a defined contribution plan, and that's really what it was in my first years in practice, and it's better, and we probably should go. There's no doubt there's increased regulatory barriers, no doubt there's increased regulatory costs, problems with taxation, pressure on venture capital, the closed IPO market. These are all negatives as well, so I don't want to sound too much like a Pollyanna, but again, when I look at the data, I see a great opportunity for innovation in our field. And I'd be less of an optimist if I was an internist or a pediatrician, but as an ophthalmologist and the great opportunities we have, particularly with patient-shared responsibility for the costs, I remain quite an optimistic ophthalmologist. So ophthalmology as a field is definitely, in my opinion, financially robust. One of the reasons I think we're attracting more than average investment capital is this fact. One of the reasons major strategics have moved into the field is this fact. and we really still have the opportunity to create our future. We're fortunate and blessed, I think, that we have investments from venture capital, new technology coming, and strategics that are willing to acquire them and then distribute them, and ophthalmologists that can afford to buy the technology and apply it to their patients. So future is now. Lots of this is happening right at this minute, and it's exciting to be a part of it. Thank you very much.